Welcome, everyone. My name is Jessica Suniga. I am the admissions advisor here at the College of Pharmacy. Thank you so much for joining us. Today, we are doing a presentation on the different career pathways in pharmacy. We do have Dr. Shamsi joining us. So Dr. Shamsi is an academic fellow here at the University of Houston. She actually graduated from the College of Pharmacy with her Pharm.D degree back in 2017. Since graduating, she has had 5 years of work experience in the community setting. She's also been involved in projects in her company, including training other pharmacists as well. Currently, she is completing a 1-year academic fellowship here at the University of Houston. So I'm going to allow Dr. Shamsi to start her presentation, just whenever you're ready, Dr. Shamsi.
All right. Can you guys hear me okay?
Yes, we can hear you and we can see your slides.
Perfect. All right. Thank you so much, Ms. Zuniga, for that introduction. Again, my name is Dr. Shamsi, and I want to thank all of you guys for joining us today while I talk to you about my two favorite topics, which are pharmacy and ice cream. All right. So just to give you guys a little hint of what we're going to be talking about today, I am going to be discussing a couple of different career opportunities that are available for pharmacists after graduation. We'll touch on a few of the roles and responsibilities for those opportunities, and then we'll also talk about some potential training requirements for those career options. So to get started, first thing I'm going to tell you guys is that I know we all have our favorite ice cream flavor. Mine is mint chocolate chip. And you're probably sitting there going, oh my gosh, that's crazy. That literally tastes like toothpaste. And I'm here to tell you that you're right, but I still love it. And just like that, I'm sure that all of you guys have your very own favorite flavor of ice cream. Pharmacy is similar in that there are tons of different career options out there for pharmacy, just like there's so many flavors out there for ice cream. So if you are a big Cherry Garcia fan or Mocha Almond, then there is a pharmacy career option that is just right and perfect for you, just like mine is mint chocolate chip. So before I get started, I'm just going to make a disclaimer that this is in no way an all-inclusive list. There are tons of pharmacy career options out there that we're not going to be able to talk about today just because we would literally be sitting here all day if that was the case. And so I went ahead and narrowed it down to the top 12 that you guys might be interested in, or the ones that might be the most commonly seen. Perfect. Let's get started. So the first one that I'm going to talk about is the one that you guys probably are the most familiar with, which is our community pharmacy. So if you have ever walked into a CVS, a Walgreens, or a Kroger, Walmart, Costco, you've probably seen a pharmacy counter with a pharmacist working behind there with their white coat. Well, that is your community pharmacist. And what they do is they actually work directly with customers in order to fill and dispense prescriptions that are coming in from the doctor's offices. Now, that might be what it looks like the only thing that they're doing, but they're actually doing a lot more than just that. They're also calling your doctors to make sure that the medication is appropriate. They are helping to make sure that the cost is as affordable as possible. You guys know how expensive medications can be. And one of the biggest ones is that they're counseling all the patients that are coming in that might have questions on how to use the medication. Now, most interesting thing about community pharmacists is that they are the most accessible healthcare providers out there. And what I mean by that is if you come up to the pharmacy counter and talk my head off for 10 minutes and ask me questions all about your medications, I am not going to send you an itemized bill for $500 at the end of the day. All right. Our assistance is free. We don't charge for it. And also we can answer all of your questions. No appointment needed, no wait time, anything like that. And so another aspect of that is if you guys have recently received your flu shot, for this flu season, or if you got your most recent COVID booster. You probably went to a pharmacy for it. Why? Because we are, again, the most accessible in the community to be able to give you that vaccination, come in, come right out, help you as you need it, give you those COVID boosters, different tetanus vaccines, hepatitis, all of that stuff. Where will you find us? Well, community pharmacists have not just the CVS and Walgreens practice sites, but also there are independent pharmacies out there that are not associated with a chain. There's also specialty pharmacies. What specialty means is there are specific medications that are not very easy to get, really expensive, hard to store. And so these specialty pharmacies are created in order to be able to still dispense and help our customers with all of these special medications and complex diseases. All right. The other option is also mail order pharmacies, which nowadays is gaining a lot of traction. I know I love online shopping. I literally order everything online, so it comes straight to my house. And so we can see why mail order is becoming even more and more popular by the day. So that is our community pharmacy. Now, in the pharmacy sector, 40 to 50% of pharmacists that graduate do end up going into the community setting. However, that is not the only option. That's the rest of this presentation. We're going to be talking about all the other career options that are out there for pharmacists. Starting with our hospital pharmacy. So if you guys have ever been inside of a hospital, you have probably seen all these different medications that are running from floor to floor, going to every patient's room. All of those medications are coming from somewhere. And that somewhere is a pharmacy down in the basement, or it could be a pharmacy on the floor in a different section. And there's a pharmacist there who is looking at and verifying every single order that is being placed by the doctors or the nurses and making sure that everything is safe and effective for the patient. Sometimes that also means being able to answer questions. Some doctors might ask the local pharmacist, I have this patient with this problem, what medication can I use? Or you'll have some nurses that want to know, hey, can I mix this drug with that drug? My patient just got this. Is this okay to give? And the pharmacist has to be able to answer those questions or either look it up and get back to them right away in order to be able to help that patient get their medications. Another really big part of hospital pharmacy is being able to prepare and verify those really sterile medications like IV drugs. If you guys have ever been in a hospital room with a patient, you probably remember a bunch of bags hanging off to the side with lines running all the way into the patient. Those are your IV medications, and they do require a lot of special care and attention in order to dispense them. That is where your pharmacists come in. They are experts in making sure that the medication that was prepared was done in the safest, most sterile way possible, so that when it goes out to the patient's floor and it goes inside of the patient, it does not cause any side effects or any harm to that patient. So, lots of different roles for our hospital pharmacists. Another big thing is the clinical pharmacy side. So if you're in a hospital and you see a bunch of pharmacists running around, they might be your regular hospital staff pharmacist, or they could also be your clinical pharmacist. And what does that mean? Well, clinical pharmacy is a subspecialty of pharmacy where the pharmacist gets a specialization in a specific clinical area. So that could be anywhere from cardiology to pediatrics, HIV, oncology. When you guys are in pharmacy school, hopefully soon, you will learn all about these different disease states and all of the different medication options that we have for these clinical areas. And if any one of them sounds super cool or super interesting to you, then after graduation, you can pursue a specialization in that field. Now, what do clinical pharmacists do? Well, they get to do a lot. they actually become this really integral part of the medical team for a patient. They get to go on rounds with the team and make recommendations. So a doctor might diagnose the patient with a condition, but oftentimes they're going to look at their clinical pharmacist and ask, well, what do I use for treatment? And you have to be able to come up with treatment options, and you have to be able to monitor the patient to make sure that based on their labs, this patient is doing okay, that they're safe, there's no issues. Another thing is you have to be able to provide education. So for example, if you are working in an HIV clinic and a patient gets diagnosed for the first time with this really life-changing condition, they are going to be on some of these medications for the rest of their life. And you are going to be the one to have that one-on-one with the patient to give them all the information that they need in order to take that medication in a safe and effective way. So most people really enjoy clinical pharmacy because of all the different career options and variety that there is available to specialize in. The only caveat is that because you really need that extra training to become specialized, this does require either 1 to 2 years of formal training after graduation, also known as a residency. All right. So moving along to our next career option, this is a fun one for anybody who loves to work with their hands, and that is our compounding pharmacy. So to give you guys an idea of what a compounding pharmacy is, I want you to imagine a patient who is severely allergic to something like soy. All right, so a patient has a life-threatening soy allergy. Unfortunately, some of the medications that the patient needs to be on are made with an active ingredient of soybean oil. So unfortunately, the patient cannot get their medication without that soybean in it on the market. So that's where our compounding pharmacy comes in. Our compounding pharmacy is actually able to hand make customized medications for very specific patients with very specific needs, like a soy allergy. So they are able to make, for example, a tablet of that same medication with a different inactive ingredient that replaces the one the patient's allergic to. Another reason we might go to our compounding pharmacies is if you think about a medication that is only available as a tablet and it is for a child who can't swallow, right? So you could turn that tablet into a liquid or a lollipop or a little lozenge candy that the child could suck on. It's a lot of creativity, but also a lot of following the recipe, working in a lab, doing measurements, a lot of hands-on work that happens in the compounding pharmacy. Now, as a pharmacy student, you do get to experience what compounding pharmacy is like in the pharmacy school setting. However, if you want to specialize in it, then you can get that special training on the job after graduation. Moving along to our next career choice is our industry sector. So, guys have probably heard of these names before. Pfizer, Johnson & Johnson, Merck, Novartis, Moderna. There are tons of different pharmaceutical companies out there, and they do have a pretty high demand for pharmacists. Reason being is that pharmacists play an integral role in a lot of different sectors of the industry market. Pharmacists can work in the R&D department. They can work in drug information centers. They can help with quality assurance, the regulatory affairs, even sales and marketing. One really popular role in the industry sector is called the medical science liaison. The reason why I know about this is because this is one of those roles that is perfect for someone who loves to travel. What a medical science liaison does is they actually become medication experts on a particular medication that was either just approved or just newly coming out onto the market. And what they do is they travel all across the country, talking to different healthcare providers, doctors, physicians, nurses, and basically answering all of their relevant questions about that medication. And so they really become these drug experts on that specific medication for the pharmaceutical company. Now, for this field, although I did put on here that it might require additional formal training, it doesn't always require it. So there are a lot of people that are able to do a career change, go into a specific area of pharmacy, work for a couple of years, and then transition into the industry market. But the other way to be able to do it is after graduation to pursue some kind of formal training with a residency or fellowship. All right, so moving right along. Once we talk about pharmaceutical company, there is probably one other large company that you are thinking about, and that is your health insurance companies. So that is where our managed care pharmacists come in. Health insurance companies rely on pharmacists as the clinical drug experts in order to be able to make decisions about things like what to include on the formulary, what is going to be the most cost effective for a treatment option, what is the best new medication for a certain condition that we should include on our coverage. So pharmacists that are working in the managed care sector get to do a lot of different data processing. They get to sit down and look at a lot of new literature. What that means is basically going through all of these different articles, these research papers that have been published in order to decide if a particular medication is going to be beneficial or not beneficial to put on the formulary. Now, all of these things, as interesting as they are, can oftentimes require that postgraduate training through a residency. Not always. However, if you think about the kind of work that you're doing, you might have to get that extra special training in the postgraduate phase. Okay, so now we are on my absolute favorite topic, which is my mint chocolate chip of ice cream, basically. And that is our academia sector. So pharmacists are definitely really high in demand in the academia. And that is because we always need someone to train the next generation of pharmacists and healthcare professionals. They are absolutely essential to everything that happens in a pharmacy school. And basically, the roles and responsibilities of a pharmacist in academia are three things. You have your teaching responsibilities, your scholarship, and your service. So the first, teaching, is really all of the things you guys are probably familiar with, which is professors giving lectures, maybe they're leading you in lab, in active learning environments. All of that stuff goes into the teaching part. Then you have your scholarship. And what that means is basically research. So all faculty members or, pharmacists in academia are responsible for doing some kind of research, some kind of scholarship while they are also teaching. On top of that, there is always the third one, which is service. What that means is a lot of the pharmacists in academia are responsible for maintaining a practice site so that they can keep up to date with their license, so that, they're always learning on the job. And when they come into the teaching, they can stay on top of the license and what's going on in the field. Now, that's a lot of stuff. There are different roles in academia for pharmacists. The first is a clinical faculty role. That one focuses more so on that practice site. And so oftentimes you'll see clinical faculty who are at the hospital 1 month and then, at school 1 month, and then they swap back and forth. Your research faculty will be those faculty members who do a lot of teaching, but also spend a lot of time on their research. Then you have your administrative faculty, which will do a lot of teaching, but also make sure that everything is running. For example, I would literally not be talking to you guys here today if it weren't for our administrative faculty. In fact, the pharmacy school probably wouldn't even be existing without those administrative faculty members to keep it running. So those are the different roles available. Now, because of the nature of the work in academia, it does require a little bit of either work experience, an advanced degree, or a residency or fellowship, like the one I am currently completing. All right. So this next one is for all of you animal lovers out there. If you guys are absolutely super big on all those cute little animals, then veterinary pharmacy is the one for you. So did you guys know that there is a sector of pharmacy that is focused just on animal care? That is your veterinary pharmacy. And the biggest difference between community pharmacy and veterinary pharmacy is that your clientele is actually pets, right? And so instead of working with patients, human patients, you are filling and dispensing medications for animals or pets. And you have to be able to counsel the owners of those pets and work with the veterinary offices in order to get different types of medications for these animals. Now, one really cool thing I have learned recently is that cats actually love fish sauce in their medications. And so as a veterinary pharmacist, you are probably going to be discovering all these cool little niche things that make our medications more basically tasty and easier for our animals to take. But this one is really fun. If you are interested in this one does not require any specific postgraduate training. However, you can always request a rotation through a veterinary pharmacy in your practice year for pharmacy school. All right, so now we're going to get just a little bit more dangerous. And that's a joke because there's a lot of safety protocols that keep us safe in this field. And that is our nuclear pharmacy. So if you guys don't know what that is, nuclear pharmacies work specifically with a sector of medications that are radioactive. You're probably thinking to yourself, oh my gosh, why are we dealing with radioactive drugs? That sounds crazy. Well, you'll be surprised. Some radioactive medications are really essential in using for diagnosis and for treatment options, like, for example, for some specific cancer types. Now, in order to be able to handle these medications, in order to work with them, dispense them, you have to have a pharmacist that is very specially trained. There is a lot of safety protocols that go into it, a lot of gear that you have to deal with and be comfortable with. However, one of the biggest selling points about this field and why pharmacists that I know still love this so much is the working hours. So if you are a really big night owl or you like to get done with your workday by like 1 or 2 p.m. and have the rest of the day to yourself, this is the field for you. A lot of the hours for this is oftentimes really, really early morning or oftentimes an overnight shift. Now, because of the nature of this job, this is one of the ones that requires a lot of very specialized training. And oftentimes that can be given through a special certification program, but also you have to be able to get 500 practice hours inside a nuclear pharmacy in order to become certified as a nuclear pharmacist. Alrighty, so now we've got an ice cream flavor for all our tech lovers, and that is our informatics field. So if you guys, again, have ever been in a hospital setting, you know that doctors are always placing orders for medications for patients. And the software that they are using to place those orders actually stops them from doing crazy things. For example, if they try to place an order for metformin 10,000 milligrams, the system is simply not going to allow it. Why? Because on the back end, a pharmacist has gone into the software and said, you cannot order metformin 10,000 milligrams. That will kill the patient. And so all of these different safety alerts and safety stops and order sets that, as we call them, are created, but with a clinician looking at the software and making those decisions on the back end. That is where our informatics pharmacist comes in. Our informatics pharmacist uses their knowledge of clinical medications and incorporates it into the technology that is used to provide patient care. So basically, this has to do with a lot of software related things, working with a lot of data, medication related information, looking at, these are the different medication errors that are very common in this clinic or this hospital, and figuring out ways to basically prevent those errors and stop those errors from occurring. So if you love tech and you love that clinical aspect of pharmacy where you're really applying that knowledge of medications and medication errors, then this is the perfect field for you. This does require some formal postgraduate training or for you to have some kind of background in technology. All right. This is another fun option, our ambulatory care pharmacists. Now, this is a really popular option, and the reason being is because our ambulatory care pharmacists are pharmacists that work inside clinics or primary care provider offices, and oftentimes they are seeing patients in the same way that a doctor might. So if you guys have ever been to your primary care physician for a regular checkup or an annual physical, you probably had to call, make an appointment, and then go and see them. Well, ambulatory care pharmacists are similar in that if they are in charge of your care, you're going to call, you're going to make an appointment, you're going to go in just to see them, and they are going to see you about your chronic diseases. The way that they do this is ambulatory care pharmacists practice under a collaborative agreement with a physician, and that agreement allows them to be able to prescribe medications, stop medications, adjust your doses, all without any further approval from the doctor. So basically, ambulatory care pharmacists have a lot of this autonomy to be able to provide care directly to patients in this one-on-one setting. The kinds of diseases that they'll manage will be specific to what their agreement allows them to do. A lot of those diseases are usually like the chronic disease states. So if you think about diabetes, hypertension or high blood pressure, high cholesterol, those are the kinds of disease states that you might see your pharmacist for management of. Now, this is a field that does require that extra postgraduate training through residency. And if you think about it, it makes sense because if you're going to be managing the treatments, writing prescription orders, adjusting doses, you are going to want to have that extra year of training in those specific chronic diseases before you're able to do that. All right. And last but not least, for our topics today is our consulting pharmacist. So if you guys have ever seen your grandmother, grandfather, or an elderly person with their long list of medications or their big pill box full of drugs, you'll realize that a lot of our elderly patients have a lot of different medications. And so oftentimes it's really, really important for someone with an expert eye, like a pharmacist, to be looking at those treatments and making sure that patient is not on 2 drugs for one thing, or the patient is not taking something for no reason at all, or patient's not having side effects to, X, Y, and Z medications. And so all of that drug expert advice really comes in when a consulting pharmacist comes and sees these different patient regimens by going in and working with those doctors and nurses in places like hospitals, skilled nursing facilities, rehab facilities, home health, a lot of different areas. This one is actually interesting because it is a little bit of more of a flexible schedule. Depending on the practice site that you're working for example, a skilled nursing facility, you might visit them twice a month, and you might visit the other nursing facilities throughout the month. Now, that does mean driving around a lot, but every time you go and visit that facility, you sit down, you review all the different treatments for all the different patients that are in that facility and make recommendations as needed. So really flexible schedule, lots of transit, but also extremely rewarding because as the drug expert, you catch a lot of things that basically get missed or fallen through the cracks. So a lot of a lot of pharmacists that go into this consulting work absolutely love what they get to do because of all the impact that they can have on this very vulnerable population of elderly patients. All right. So that was a lot of information. Okay. And of course, we'll answer all of your questions and answers, but I just want you guys to know that, again, this was not an all-inclusive list. We have so many other options out there for pharmacists in different careers. There are tons of different ice cream flavors for us to choose from, anywhere from management to public health to military. Did you guys know that there is an area of pharmacy just for aerospace? Because I did not. Apparently, astronauts have to be on totally different medications because they're in zero gravity situations. Also, we need pharmacists working with the CDC and the DEA and the regulatory offices. So there are tons of other career options out there. And the ones that we talked about were just a quick sneak peek. All right. That's everything I have for you guys. And I think Ms. Zuniga is going to be opening for questions.
Yes, so there is a Q&A box at the bottom of your screen. If you have any questions, make sure to type it in there or raise your hand and we can get those questions answered for you. Thank you, Dr. Shamsi. That was a lot of good information. It makes me want to start my Pharm.D application. Those are a lot of interesting fields. So we do have one question from Andrea. So she does want to know if we can get a copy for her so she can review this information. So actually this session is being recorded. It will be posted on our YouTube channel. So if you haven't already, check that out. And then also make sure that you do fill out our Get Connected form. As soon as it does become available, we'll email you that link for the video. So I'll go ahead and share that with you. And then everyone else, any questions, please post them, or like I said, raise your hand. While we're waiting on others to ask questions, I do have a question for you, Dr. Shamsi. So I know that your favorite is academia, but if you weren't in academia, what would you be choosing?
Yeah, so it's interesting because I actually have a background in community, but if I were to choose my next favorite after academia, I would say it was ambulatory care. The reason being is the level of autonomy provided to you as a pharmacist is so essential. You get to be able to write your own orders, make adjustments as needed. It really, basically enforces this idea that pharmacists are essential healthcare providers that are capable of lots of clinical services. And ambulatory care is a way to be able to prove that.
That's great, thank you. So we have a question from Gabby. Her question is, do consulting pharmacists need a residency or postgraduate experience?
Awesome. Yeah, so to that, I would answer they might. More often than not, I don't usually see postgraduate trainings that are specializing in consulting. However, it depends on the type of consulting. For example, if you are a consulting pharmacist for a hospital, you might be required to do that postgraduate training. If it's a skilled nursing facility, it might be more lenient, but you would require to at least have a rotation for consulting in your practice years in the pharmacy school.
Okay, great. And then a follow-up question for that is, for fields that do require a residency, since they are specialties, do they get paid more than regular Pharm.D pharmacists?
So it really depends on the practice site. In terms of income levels, that would be something I suggest for you to check out on the wage. I think it's BLS post wages. But if you're comparing it to, for example, the staff pharmacist salaries at that same facility versus the clinical pharmacist salaries, then I do believe it is higher.
Okay, great. And then in the meantime, while we're waiting for more questions, we do have a survey. If you could just please take a couple of minutes, it's pretty short, just we do want your feedback regarding today's presentation. I went ahead and dropped the link in our chat. Just go ahead and use that. I'll also share my screen real quick. If you want to use the QR code to fill out the survey, you can do that as well. Any other questions for Dr. Shamsi? Oh, there's more. Okay, so since there are only maybe 5 states that allow pharmacists to prescribe, does the ambulatory care pharmacist get an override? In other words, if they work in NC, will they be able to, I guess, prescribe if they are in ambulatory care?
Yes, so this is a very good question. The way ambulatory care pharmacists work is they have an agreement or a contract with a particular physician. And that contract could be as detailed as they want it to be, or it could be vague. It could say that, the pharmacist is allowed to prescribe only these medications, or it could say pharmacist is allowed to prescribe anything for diabetes. They're allowed to adjust anything for hypertension. They're allowed to discontinue anything for cholesterol. And so to answer your question, yes, this prescriptive authority, as it's called, the ability to prescribe, it can be given to any pharmacist that even if they're working in a state that doesn't allow pharmacists to prescribe, as long as they have that signed agreement with a physician.
Okay, awesome, thank you. So it looks like we don't have any other questions for Dr. Shamsi. I do know that you do have other appointments after this, so thank you so much for joining us today. That was very helpful. If anybody does have any questions, I'll make sure to follow up with you and then follow up with the students as well if any questions do come up. And then I do have a couple of questions that are just regarding admission requirements. I can go ahead and take care of those, but thank you again, Dr. Shamsi.
Thanks so much for having me.
Thank you. You have a good day.
Bye-bye.
Bye-bye. And then for our other questions, Andrea, you did have a question regarding admission requirements, whether you can take them at an online or community school. Yes, you can, as long as it is an accredited institution. You do not have to take those courses in person nor at a university. It can be a community college or online as long as they are accredited. If anybody else has questions regarding any admission requirements, my contact information is on the screen. You can just go ahead and email me at any time. You can set up an appointment, give me a phone call, whatever works for you, just go ahead and reach out. Any other questions for admission requirements? Okay, it looks like we don't have any more questions. Thank you everyone for joining us today. You all have a good day.